Hello friends, in this video I have talked about pathogenesis of cell injury. So let's get started. In cell injury, first I will talk about the causes of cell injury. So cell injury can be because of hypoxia, which can be a result of deficiency of oxygen due to cardiorespiratory failure, anemia, carbon monoxide poisoning, etc. Then it could be because of ischemia whenever there is decreased blood supply to the tissue, either due to arterial block or reduced venous drainage. It leads to ischemia, which can cause cell injury. Physical agents like burn, cold, mechanical trauma, radiation, electric shock, etc., can lead to cell injury. Biological agent ranges from the submicroscopic virus to the large tapeworms. In between are the rickettsia, bacteria, fungus, and other forms of parasites which can cause cell injury. Other forms of cell injury can occur due to immunological causes, chemical agents like toxin, drugs, alcohol, free radical injury, genetic abnormalities, and nutritional imbalances. The cell injury is of two types, reversible and irreversible. When there is reversible cell injury, the cell can swell and show fatty change. When there is irreversible cell injury, the cell can undergo necrosis or apoptosis. Talking about the pathogenesis of cell injury, well, whenever there is ischemia, there is decreased oxidative phosphorylation in the mitochondria, causing three main effects. First is the sodium potassium ATPase pump failure. Second is detachment of the ribosomes from the endoplasmic reticulum. And third is increased anaerobic glycolysis. When there is sodium potassium pump failure, there is increased efflux of water, which causes cellular swelling and membrane damage. Also, it causes endoplasmic reticulum swelling due to increased influx of the water. When there is detachment of ribosomes, it leads to decreased synthesis of the protein. And there is when there is increased anaerobic glycolysis, there is increased accumulation of lactic acid, which again contributes to cellular damage. Here I have elaborated the mechanism of damage to the membrane. Whenever there is cellular injury due to reactive oxygen species, there is peroxidation of the lipid which leads to membrane damage. Also, whenever there is hypoxia and there is decreased ATP production due to reduced oxidative phosphorylation, there is decreased phospholipid synthesis which further damages the phospholipid membrane. Whenever there is increase in the cytosolic calcium, there is phospholipid activation which causes increased phospholipid degradation and leads to membrane damage. Also, protease activation, whenever there is increased cytosolic calcium, can cause cytoskeletal damage. In this flowchart, I have mentioned how various factors which causes cell injury like hypoxia, radiation, reactive oxygen species, mutations, etc. can lead to mitochondrial damage, membrane damage, and nuclear damage and contribute to necrosis and apoptosis. I have on my channel given lectures on necrosis and apoptosis. You can see those lectures to know more about necrosis and apoptosis mechanism. This was on a special request by one of my followers. If you want me to make video on your topic of choice, do let me know and I will make those videos. Thanks and bye for now.